January is National Blood Donor Month, and I bet you didn't know Cook County Hospital is home to the world's first blood bank. Here to talk more about this is Cook County Health Chief Medical Officer Dr. Claudia Fegan. Dr. Fegan, thank you so much for being with us today.
Thank you for having me.
Let's talk about that. So it's been almost 86 years since the first blood bank was here in Chicago. Can you talk about what was going on at that time and what made it so crucial that Chicago needed to have a blood bank?
Right. Well, that the world needed to have a blood bank, right? It was Bernard Fantis, who was born in Budapest, and lived in Oak Park. Came up with the idea. He coined the term blood bank, and he thought of the idea if you could have blood that was banked or saved, and then people could withdraw it when they needed it. Prior to that, if you needed a transfusion, the person who was donating had to be immediately available. So every surgery was dangerous. People need blood because things happen, whether it's an accident or you need to have surgery or an operation. Even in childbirth, there are women who need to have a blood transfusion. And he realized that if there was some way of preserving the blood and having it available instead of having to frantically look for a donor at the time that the need occurs, that it would be much safer. It revolutionized medicine. It changed the way we practice. It allows us to have blood available for anyone who needs it. And we never know when we might need, or a family member might need blood, whether it's because they have a serious accident, because they have an injury, because they have developed cancer and they receive medication that suppresses their ability to make blood. There's no way of predicting in advance. And so the idea of saving it up makes a huge difference.
Very good point there. And speaking of talking about having blood saved up, we keep hearing the words across the country, dangerously low. Is that the case here in our area?
Yeah, well, January is typically a month where we struggle because we depend on the kindness of folks to come out and make a donation for blood. And most people are donating, not for anyone in particular, but donating so that it will be available when they need it. And so in January, when the weather is cold and nasty, people don't necessarily feel like leaving their homes. We were very severely limited earlier in the month, but we've had a number of blood drives around the city. And we're, I would say, okay right now, but it's always iffy in January and February in terms of encouraging people to come out and donate and making it available for whether you or a family member might need it. So we're always dependent upon folks to be generous enough and realize that none of us can predict when we need blood, and we want it to be available when we need it, so we should donate it now for those who can use it every day.
Very, very true. All right, Dr. Claudia Fegan, thank you so much for joining us today on First at 4.
Thank you, and donate if you can, please.